Although Ethiopia is undergoing minor stage 2 epidemiological transition, there are still health issues that need to be addressed in order to increase life expectancy. Group 1 diseases occur largely in poor population, especially in Ethiopia where they do not have resources to treat them. Communicable diseases in Ethiopia make up 75% of the burden of disease, which suggests a slower pace of population growth and medicinal innovation leading to a slower epidemiological transition.
Diarrhea is a leading cause of death in not just Ethiopian children, but in adults as well. This makes diarrhea one of the top health issues in Ethiopia. In 2010, diarrhea consisted of 40% of causes of death in Ethiopian children less than 5 years old, where 42% of that was due to non-rotavirus and 28% was due to rotavirus. The top causes of death for children is pneumonia. Pneumonia kills more children less than 5 than does the diseases of HIV/AIDS, malaria, injuries, and measles combined. In 2010, it was the greatest cause of disease, making up 21% of all children less than 5 years old. The top 3 health issues that Ethiopia must address urgently to reduce further mortality are diarrhea, lower respiratory infections, and tuberculosis. These communicable diseases are the most prevalent and remain as the top cause of mortality. Diarrhea is the #1 public health issue because it has been within the top 3 causes of death in Ethiopia since 2005 and has progressively become the #1 cause of death as seen in 2016 data. This is followed by lower respiratory infections, which almost remained in the top 3 causes of death in the past decade. Lastly, although its prevalence lies below ischemic heart disease, we have chosen tuberculosis as the 3rd most important health issue in Ethiopia. This is because tuberculosis has consistently remained a top cause of death and also causes more premature deaths than ischemic heart disease.
Go. The major risk factors of lower respiratory infections are air pollution, child and maternal malnutrition, tobacco, as well as alcohol and drug usage. The undernourished are more prone to lower respiratory infections. Annually, child and maternal malnutrition cause 2,468 of healthy lives lost per 100,000, whereas air pollution from the environment causes a loss of 1,910 lives per 100,000. As for the diarrheal diseases, the 2 main risk factors are unsafe water, sanitation, hand washing, as well as malnutrition. Water from areas such as sewages and ponds that have been contaminated with human or animal feces can cause diarrhea-related diseases. Children who are malnourished and those who have impaired immunity are most at risk of life-threatening diarrhea. These factors are responsible for 98.2% of total deaths in Ethiopia. As for tuberculosis, those who have a weakened immune system as well as certain diseases such as cancer and HIV have a higher risk for developing tuberculosis. The air pollution is a major contributor to tuberculosis in many homes, and the use of solid fuels for cooking has been perceived as a risk factor for tuberculosis.
To combat the problem of pneumonia and diarrhea, an integrated community case approach can be used. Vaccinations against severe diarrhea is also a safe and cost-effective way to prevent the disease. The lack of clean water is a major concern in Ethiopia. Organizations should help improve access to sanitation, such as water wells made available to communities in Ethiopia. Improved access to water can be done by evaluating, understanding, and responding to the consumer demand for water and sanitation services through market-based approaches. A successful implementation of water and sanitation projects requires continuous monitoring and evaluation, which promotes accountability and sustainability of the programs for the long run. In addition, improving agricultural practices to reduce its water usage would be beneficial, since agriculture is the greatest water consumer. Improving agricultural efficiency will also address micronutrient deficiencies because it would increase dietary diversification and have more food readily available. All of these factors will reduce the fecal-oral transmission of the rotavirus to improve life expectancy of the vulnerable group of children under the age of 5.
About 95% of the population of Ethiopia use their traditional biomass fuels for household and energy needs. As a result of the smoke emitted from the combustion of biomass fuels, indoor air pollution is responsible for more than 50,000 deaths annually and causes nearly 5% of the burden of disease in Ethiopia today. Therefore, Ethiopia should start using clean fuels, liquid petroleum gases, and efficient cooking stoves to improve their indoor air quality. People also should dry wood before burning so they can decrease smoke production and make sure children and pregnant women are away from the smoke. Air pollution is also one of the major contributors to tuberculosis. The government needs to improve their technology in the medical facility and healthcare system so that healthcare workers will be able to diagnose tuberculosis in an effective manner and guarantee that all people in Ethiopia has an equal chance to receive medicine and treatment. There are numerous strategies to eliminate tuberculosis. This includes patient management to minimize the risk of transmission of the disease, prevent patients with infection control, and outbreak control. There are 3 steps to this plan. Step 1 includes an effective use of existing prevention and control methods. And step 2, the development and evaluation of new technologies for diagnosis. And lastly, the rapid assessment of them into clinical and public health. BCG is a vaccine for tuberculosis. The spread of the disease, houses should be ventilated and patients should spend a lot of time outside but spend less time in crowded areas.